guys, welcome back to my channel. I'm Dr. Sylvia, a general practitioner and writer, and this is AskAwayHealth, where we provide you with direction and clarity about everything medical. The measures to manage sickle cell anemia, the inherited condition that affects hemoglobin in the blood, which can cause significant illness, have evolved over several years. In this video, we're looking at the current, that is the most recent updates for potential cures we have available in 2020. Now, for several years, a cure for sickle cell anemia has been largely elusive. In places like Nigeria in West Africa, the country that has the highest burden for sickle cell anemia, people hardly talk about a cure for the disease, and people who suffer with sickle cell anemia resign themselves with preventing as much as they can sickle cell crises and taking treatments that can promote their health as much as possible. However, for some years now, there has been a cure, but it has been mostly available in high-income countries where there are adequate facilities and effective healthcare infrastructure to manage the process of delivering the cure and maintaining people's health afterwards. That cure, though, called stem cell transplant, has developed challenges in terms of its use and its administration, and so a lot more recently, within the last 6 months, a new alternative has developed known as gene therapy, and we're going to talk about both of them. Let's start with stem cell therapy. Stem cell therapy in sickle cell anemia requires that the individual with sickle cell anemia who is going to undergo treatment has a healthy brother or sister from whom stem cells can be taken or harvested in order for the procedure to be carried out. Now, stem cells are particular types of human cells that can develop into many other types of human cells, for example, muscle cells or brain cells or bone cells. How do we get stem cells? There are two main sources. First, human embryos. Some human stem cells are produced from embryos, that is immature fetuses, during in vitro fertilization and donated to science. Other stem cells can be formed from fully developed adult cells. The critical thing about stem cells is their ability to develop into other types of cells inside the body. So essentially, in stem cell therapy for sickle cell anemia, it is thought that the healthy cells taken from the donor's bone marrow will be transplanted into the recipient and develop into non-sickle cells, red cells, within the recipient, the person who's suffering from sickle cell anemia. Now, like I mentioned earlier, there are some challenges with stem cell therapy. One of the problems is that many people with sickle cell anemia do not have a healthy relative or healthy sibling, brother or sister, who can act as a donor for normal or healthy stem cells to be harvested from. The other problems that could happen is that they may develop serious complications following the transplant, assuming they're able to get a sibling donor. There may be serious complications after the transplant, or the transplant may fail. And the thing is, stem cell science is still evolving, it's still developing. There's still a lot for scientists to learn about techniques with which the stem cells can be controlled and used appropriately the way you want to for the benefits of science, of medicine. And there's also the issue that some people find it troubling to use stem cells obtained from embryos that are not used after cycles of IVF. But an alternative solution has come up, and this is gene therapy. In gene therapy for sickle cell anemia, it is the patient, the person who suffers from sickle cell anemia, it's their own stem cells that are used, so removing the need for a compatible donor. Now, to understand how this works, we need to digress a little bit and talk about the role of fetal hemoglobin in sickle cell disease. Now, fetal hemoglobin, or hemoglobin F as we also call it, is unique for quite a few reasons. Number one, it appears to be very well suited for supporting or maintaining the baby within the womb's low oxygen environment compared to normal or healthy adult hemoglobin. researchers have also found that the presence of fetal hemoglobin prevents the formation of sickled red blood cells. Now, after birth and as they develop, infants or young babies gradually stop producing this fetal hemoglobin and instead start to develop what is the adult hemoglobin, the hemoglobin that they will eventually continue with as older children and as adults for the rest of their lives. Now, this process where they stop producing hemoglobin, fetal hemoglobin, starts or tends to happen from about 4 to 6 months of age. So what you find is that from about 4 to 6 months of age in children with normal hemoglobin genotype, the hemoglobin F will be replaced by hemoglobin A. But in a child with the SS genotype, their hemoglobin F is going to be replaced by hemoglobin S that causes sickling of the red blood cells. Now, the crux of gene therapy, and this is research that's still ongoing with clinical trials that are presently going on at the Boston Children's Hospital in the United States. This research has shown that the production of fetal hemoglobin can be reactivated, which in the case of an individual with sickle cell disease will reverse the condition. Now, the scientists working on this believe that this process can be reversed by the activity or suppressing or preventing the activity of a protein called BCL11A. And so what they do is they use an inactive virus to deliver instructions, genetic instructions, to the RNA of the red blood cell of the person, the individual with sickle cell disease. And these instructions are meant to drastically reduce the production of this protein BCL11A in the individual's red blood cells. And this is what allows the reversal from the adult hemoglobin in that individual to the fetal hemoglobin. Okay, so it's a lot more complicated than what I've just said, and clinical trials are going on. The process is underway. They're described as promising. There are individuals who have received this treatment and they are promising results. And if you want to read more about it and find out more details, I will put a link to the paper and the research studies in the description box below. So these are the measures available for people who ask, what is a cure? Is there a cure for sickle cell anemia? These are the measures available to consider in terms of cost, accessibility, availability. They are technical, highly specialized procedures that are still being looked into in high-income countries like the United States. So the feasibility of having them performed in low and middle income countries, of course, can be quite challenging, but they are there as an option, and possibly in the next decade or less may be more available to other parts of the world. So let's watch this space. Now, if you're interested in a 7-point checklist for what people with the AS genotype should consider when they are entering relationships or generally should be aware of about their health care status, make sure you check the link in the description below, because I got a free e-leaflet on that particular topic. Now, next time in this series, we're going to be looking at the treatments available for sickle cell anemia, understanding the treatments for sickle cell anemia. So what drugs do people with sickle cell anemia need when they're having a crisis or just to maintain their health generally, and why do they need this medication? So make sure you check out that video. I'm going to put the link to the description to that video in the description below as well. Thank you so much for watching, guys. I hope this video has been useful. Let me know in the comments if it has, and like the video as well. Share with somebody who you think it might be of some value to. If this is your first time joining us or watching our channel, thank you so much for joining. Please subscribe and click the notification bell so that every time we publish a new video once a week on Saturday, you'll be the first to know about it. And until next time I see you, take care.